This is One on One. We are pleased to be joined by Dr. Mary Ann Donohue-Ryan, who is the Chief Nursing Officer at Englewood Hospital and Medical Center. Good to see you.
Thank you. Good to see you, too.
You're also Vice President of Patient Care Services. What does that all mean, by the way?
Anything that has to do with the operations, the daily operations, the daily running of the hospital as it pertains to patient care.
Yeah. And you've only been on the job for a few weeks as we speak, but you've been in this profession for a while. Why'd you even get into nursing?
Way back when, I think we all wanted to be into nursing or into healthcare to do something right for patients and their families. And you know what, Steve, that message has not changed a bit today. You know,
it's so interesting. A few years back, we partnered with you and the Nurses Association. We actually did a whole nursing week and one-on-one, and we're so proud, and you did one of the PSAs.
That's right.
Do we know enough? Because that's the reason we did that. The reason we're going to do it again is because we want to celebrate nursing. Do we know enough about nurses and who they are and why they make such a difference?
I would say we don't, but the Johnson & Johnson campaign for the future of nursing really helped put us on the map, so to speak, in terms of achieving that recognition and understanding nationally or internationally about what it is that nurses do every day.
But it's changed. I mean, even since we did that series, how dramatically do you feel the field of nursing has changed since the Affordable Care Act?
I would say that if you're talking specifically about nurses and nursing, the opportunities for nursing have exploded exponentially. And that, of course, the Institute of Medicine is saying that nowhere near will we have the capability of staffing our nation's hospitals or being out in the community to the numbers and to the extent that our public and our population really needs for our nation's health. So that's the biggest and most dramatic. But in terms of overall health care, the care for patients is really in the community and in the homes as never before. So it makes you think back to the early 1900s when Lillian Wald was out in the tenements in New York City and providing that direct care. And in some ways that has not changed. We really needed to be more upfront and personal in families' lives where real life was happening in their kitchens, around their kitchen tables, around their living rooms where mom and dad were located, et cetera, and not in a hospital.
Sorry for interrupting.
Sure.
Doctor, you talk about, by the way, you are a doctor, but let's make it clear, your background academically?
A PhD in nursing.
Boy, that's a lot of education, isn't it?
Yes, it is.
A lot of commitment while you're working the entire time, right?
Yes, and raising a family.
Yeah, all that,
but
balancing.
No different than anyone else who ever did it.
Yeah, modest as well. How about this? Let's talk about the fact that there's a community piece to this. There's something called population health, which is an expression that people talk a lot about, but in many ways, it is community health.
Yes.
Talk about it.
It's really the growth and development of community health is what population health is all about. The metrics, as we look at them in terms of our dashboards in hospitals.
Dashboards. You cannot use health jargon here. Dashboards.
Metrics. Roadmap.
For an example.
A dashboard is what you see when you turn on your ignition in your car. That's a dashboard.
Got it.
And each of those indicator lights tell you the health and welfare of your automobile, right? Your vehicle before you get in. So very rarely do we ever read the owner's manual from cover to cover, right?
Right.
But many of us jump right into a hospital experience or to a healthcare experience, never reading that dashboard, never understanding anything except that key goes in that ignition and brings you to that local hospital. So that's what a dashboard is. A dashboard tells you the health and welfare, so to speak, of that particular hospital.
But how would you even know that? How would you know how the health of the community is based on what the dashboard says?
Because there's something called value-based purchasing, and that's tied into accountable care organizations. And it is definitely, I would say, not the wave of the future. It's what presently it is that patients and families deal with. So while I'm proud to now be associated with a small community hospital, medium-sized community hospital in New Jersey, it's because we all feel as though we want to contribute to the health and welfare of the communities where we reside. So it's all happening at that community level. It's happening at the large academic medical centers too, because they're their neighborhood hospitals of choice, but never before have the community hospitals been so key to the health and welfare of patients and their families.
Another area that you're very concerned about that nurses play a big role in disease prevention.
Yes.
Talk about it.
Well, disease prevention is one of those things that also goes on that dashboard, and that has to do with preventing readmissions. So if we can prevent readmissions, prevent people from coming to the hospital and seeing an admission if it's not recognized appropriately the first time, that could be seen as a near miss, something that should not have happened.
For example?
Someone who goes home with an unrecognized disease, such as a broken bone that we didn't catch the first time when they were in the hospital, or pneumonia, or any other sort of illness, or even a complication from the surgery that brought them to the hospital in the first place. So if we didn't catch that side effect of whatever it was that they were going through, or if we failed to prepare them to be adequately treating themselves in the community with the host of community resources that we set them out for, then we've created a problem. Then it's our problem to try to fix that. And many times, as we know, insurers will not pay for a failed admission on our part, or a failed discharge.
So the economics are involved as well.
Yes, yes.
The other thing that I'm curious about is physician-nurse interaction, relationships, communication. As nurses play more and more of a prominent and influential role in the care of patients, how do you feel, how do you sense the relationship between physicians and nurses evolving?
I think it's never been as good as it is right now.
Really?
And I'm very happy, as I say to my friends and colleagues, that I've lived long enough to see everything come full circle. And our physician colleagues, our nurse practitioner colleagues, our administrative colleagues all seem to be working on the same page in high-performing organizations, of course, which Englewood is one. So that's the key there. When you look for an organization either to be cared for by your family or to work in, you want to make sure that there's a high focus on quality and team effort. And unless everyone's working together on the same team, you won't have the high quality outcomes that you need to see.
One more quick question here. I'm sorry for interrupting. Technology impact on all this?
Technology is huge, and we're raising a generation of children who are Gen Xers, who are millennials, who are really focused and tied into their devices for whatever reason.
How has that changed nursing?
It's changed nursing because we've had to focus in our early education about breaking yourself away from the devices and speaking to patients one-on-one in their eyes, looking in their eyes, sit down and talk.
Being present.
Being present in that moment, which has to do with your philosophy of patient care. Again, which is a hallmark of high-achieving organizations. You'd want to see that happen. But many times you've been going to your provider, Steve, and you'll see that the physician or provider seems to be focused on that device or the computer and rarely turns around to give you that eye contact. And that's one of those bridges that we have to build as we move forward.
Last one, Mary Ann. You've been in a lot of leadership positions. Number one leadership lesson you have learned in these years is?
To be able to understand and respect the job that people do whose boots are on the ground every day. And to never feel as though you can't pick up a tray and deliver it to a patient or answer a call bell. It has to do with everybody being equal members of the team.
Getting right in there.
Absolutely, every day.
Not above it.
No, who would ever think something like that? That doesn't work.
Dr. Mary Ann Donohue-Ryan is Chief Nursing Officer at Englewood Hospital Medical Center. Thank you so much.
Thank you, Steve.
Appreciate it.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, TD Bank, the New Jersey Education Association, PSE&G, New Jersey Sharing Network, NJM, and by the Russell Berry Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.